Today is 14th March, 14th April. So it's exactly 1 month that we had our first case. And as at now, we've confirmed 53 cases in Ashanti region with 3 deaths. I must emphasize that we've seen on the social media that they said it's 139. That is not the case. Ashanti region, officially, as at now, we have 53 confirmed cases with 3 deaths. The composition of the cases, we have 57% males and then 43% female. The last 4 confirmed cases were reported yesterday. So yesterday we had 4 confirmed cases. As at now, 3 people has recovered, and then we have 8 that's currently on admission, and they are all doing very well. The 8 on admission are doing very well. The rest, some of them are asymptomatic, some of them are mild cases, and we are managing them at home. We are hoping to get an isolation center where the asymptomatic cases and those whose environment are not good enough will be housed. They will be given residential accommodation so as to remove them from the environment where it's very possible that they may infect other people. So that's what the region is working on. So far, we've collected 13,199 samples for investigation. But yesterday alone, we took 1,543 samples. The details are as followed. The routine surveillance, we've taken 488 samples. The community screening that we are doing, we've taken 10,853 samples. And then travelers on manifest, we've taken 1,233. And then the contacts of the confirmed cases, we've taken 625 samples from them. And as at now, 340 have completed the 14-day follow-up. In the course of the week, we had donations from individuals, and we'd like to take the opportunity to thank them. Tijaniya Muslim Mission supported the region with 11,000, and an agency donated item worth 70,000 Ghana cedis to Ghana Health Service Ashanti region to support our effort to fight COVID-19. We also had donation that was done to other hospitals like Kumasi South Hospital, Manshia, Sontreso, and others. We would like to thank the donors and then thank them for all the support that they've given. We want to assure them that all the support will be used to curtail the COVID-19 in the region. We'd like to thank you for coming, and may God bless you. This is very dangerous for the region in the sense that when people are stigmatized because they've been confirmed as COVID-19 positive, it will derail our effort because people will not like to come out again, and then people will not voluntarily come out to do the testing. So we are pleading to the communities that COVID-19 cannot be stigmatized at all. The stigma is you yourself. Those people who are not observing the social distancing, they are more dangerous than even people that we've confirmed COVID-19 in them. Because for those that have been confirmed, we know they are already positive. But those who are walking around that has not been confirmed, they are going to beaches, they are going around chasing food and other things, who are positive. You may not know them. So those ones are those that we should fear. There's no need at all to fear COVID-19. The most important thing is to abide by the rules and the regulations. The hand washing, social distancing that we are talking about, the use of sanitizers, and then making sure that you observe cough etiquette, personal hygiene, and all those things are the key. It's not those who are living close to you who will transmit the disease to you. You will only get the disease when you go to the market and interact with people and you don't observe the social distancing. So this is the message. So we want people to help us with the fight. Those who own hotels and other hostels and other things can support us so that we can house the contacts and then also some of the confirmed cases. Some of them live in an environment that are so dangerous, said that once they become positive, it's likely that they may transmit the infection to people around. These are the people we need to support. We will need to house them, bring them to a residential accommodation that is befitting, and then feed them and support them so that we will observe them, and then after 14 days, we may release them if they don't have any problem. So we want the community to support us. And we want to assure them that when you give your facility out for this, it will rather help prevent infection. And there's no stigma at all. There's no stigma on the burden. There's no problem with the burden that is given out. The burden will only go to support the fight. So nobody should fear that he's giving his facility out to support this work. And we know that if all of us come together and work as a team, it will help. The second challenge is the distribution of food commodities in the communities. What we've observed is that is going against the social distancing. People always rushing and queuing for this food. The danger is that you may come for the food, but you will go with infection. So what we want to advise the authorities that have been mandated to distribute the food is that they should do it house to house. They should map out all the households that are in difficult communities, and then make sure that they visit every house. And once the people know that the food will come to their houses, they won't go out chasing for the food. So that is the advice the health authorities in the region would like to give to those who are managing the food. That we don't want to see them sharing the food in open spaces and creating kiosks. They should try and then work out a modality to get the food to the people right in their doorsteps. Because the moment somebody comes out from his doorstep, that is the first principle when it comes to contracting COVID-19. So we shouldn't motivate people to come out of their houses and create problems. The food can go to their doorsteps, and we believe that that is the best option for all of us. With the donation, we are still hoping that we will get more donation to support it, because the PPEs, we are using it because the number of cases are going up. And as much as possible, we wouldn't like the media, apart from giving education, also this morning we had a challenge with one of the media stations where they were interviewing people who were on admission and other things. I don't think that is fair. If you do that, you won't support our effort.